Good morning. I want to thank everyone for participating today in the Pitt County COVID-19 media session number 9 for Tuesday, April 14th. We will have questions, or we'll start with opening statements from Dr. Silvernail and then go to Vidant, and then we'll have question and answer. And just a note, we will go through our questions as we did in our previous session, with each media representative being called on specifically in the order that they logged on to this meeting. So we'll get right started with Dr. Silvernail now.
Good morning, Pitt County. Yes, I got a haircut over the weekend. This is the only haircut my wife knows how to do. So I'm going to ask you, what do you think? Hopefully you like it. It grows back fast, but I did not go to a barber. Yesterday, on top of everything else, we lost power at Pitt County Health Department for about an hour. We kept our doors open and continued to serve our clients by emergency lights and the limited emergency power available in our facility. Thank you to our clients for your patience through this, and thank you to my staff who were kept on working in spite of the power outage. Yesterday, we began reporting a recovered number. Like all numbers in epidemiology, this represents an estimate of those who have recovered from COVID-19. The method we are employing uses CDC guidance on when someone can return to work without restrictions, 14 days plus 1 from the date of onset or the date of test, whichever is later. This method will underestimate the recovery of some, meaning they took more than 15 days to get better, and overestimate the recovery for others, meaning they took less than 15 days to get better. There is no universally agreed upon definition of recovery, so this is how we are defining it for the purposes of reporting. As of yesterday, we estimated 28 individuals have recovered from COVID-19. We will continue to update this number once per day, and I'll give you today's number when we get to that section. We continue to see additional cases of COVID-19 in Pitt County of a rate of about 2 to 4 cases per day. Again, we remain cautiously optimistic that our social distancing and hygiene strategies are working. Please keep up the good work. We currently have 4,816 North Carolina cases, 70 laboratory confirmed cases in Pitt County, 86 deaths in North Carolina, and 1 death in Pitt County that we reported last week. We currently have, in terms of testing, 420 total persons known to be tested. We recognize that underestimates the total number of those tested. We have 70 positive results, or about 19.8%. So about 1 in 5 people with symptoms test positive for the infection. Negative results, 283, or 80.2%. So again, about 4 out of 5 people with symptoms are still testing negative in our community. Pending results at this time are 67, and this morning we report 37 recovered. Other public health issues. Remember that other public health issues have not gone away during this emergency. First, the opioid epidemic and other substance use. Stressful times may lead to self-medication with opioids or other substances, and certainly this is a stressful time. In our continued efforts to battle the opioid epidemic, we are continuing and enhancing our distribution of naloxone rescue kits. Please see our press release later today for details on this program. WIC. Please see our press release regarding additional food choices under the WIC program. They have expanded the number of items that may be purchased under WIC due to shortages of some items. And again, please remember, go home and stay home. Thank you.
Good morning. I'm Brian Floyd with Vidant Health. I want to start by again thanking our team members, physicians, and staff who every day continue to show up in a heroic way to care for the people of Eastern North Carolina, both here in Pitt County and also in our other locations. the strategy that we have talked about, the social distancing and all, is working, and that we are seeing, while we still see an increase in cases, we can see that the social distancing is having a positive impact on our ability to battle COVID-19. I want to thank the more than 100 donors who've donated PPE and all the local restaurants who've donated food and services to support Vitan Health across the region during this time. Some of the PPE we've received have been N95 masks, face shields, and goggles, and some have donated food. The personal protective equipment is much needed and appreciated. If you have questions about what more is needed or other things that are needed, you can check our website out at vitanhealthfoundation.com, where we have a listing of programs and protective equipment that is still needed. If you wish to donate, you can do so at Vitan Health Foundation at vitanhealth.com. We're asking organizations and restaurants to work directly with our foundation so that we can ensure we keep close tabs on all that has been donated. It can go through a testing process and make sure that it's safe for use should we need that in the future as we continue forward. Our community has gone so far above and beyond what we would have expected or asked. People have dedicated their time, their resources, money to help us during this challenging time, and we could not be more grateful to Eastern North Carolina as we've come together as a family to manage COVID-19. Currently at Vitan Health, we have 38 patients who are hospitalized receiving care for COVID-19. Over the last weekend, now we have expanded our testing capability. We now have reagents and the ability to test about 1,000 rapid tests per week now. We are using those tests to help bring local testing to our community hospitals. We're also using those tests in the emergency department for patients who may need that testing or become inpatients to help us manage their condition. We're using those in the inpatient environment, high-risk environments like nursing homes when there are suspected tests positive there, and now bringing those tests available to ambulatory environments under certain conditions that the physician deems it's necessary. This is leading us to even look at the elective procedures and work that we have had to postpone for patients, many of whom do need to have surgical procedures and care rendered. We are now working with local physicians to determine how will we best use the testing capability we have to determine if it's safe to proceed with some of the procedures that people have needed up to this point. We don't have those answers today, but we're now in a place where that is a body of work that we're working with physicians to determine. So again, thank you to the public. Thank you so much for doing your part with social distancing to help us keep both the community safe and certainly the team members whom the community cares for and depends on should they need us here at Vitan Health.
We'll go ahead into the Q&A session in a minute, but first I wanted to open the floor for any of our municipal or community partners that are on the call today. If you have any prepared statements, I believe we have, I know I saw Greenview Utilities, Pitt County Schools, Pitt Community College. If anyone is there that has a prepared statement. Nope, hearing none. Okay, we will start with the question and answer, and I will bring up Dr. Silvernail first, and we will again go in the order that you were called in today. So I will call each individual media agency to do your questions for him. So Dr. Silvernail. And while he is coming up, we can go ahead and the first media outlet to call in was the Daily Reflector. So Elizabeth, I think with the Daily Reflector, if you're on, if you have any questions for Dr. Silvernail.
Hi, yes. Can I start now? I'm here. Can you hear me?
Yes, yes. If you have any questions, yeah.
Okay. Oh, yes, sorry. Okay. So I know this antibody testing that people have been talking about the antibody testing, and some people aren't getting tested for the virus while they supposedly have it. So, with this recovery and everything, are you going to start testing people after they have recovered?
That testing is available by a private concern here in Greenville at this time. We have a reach out from the state health department and an academic institution to do some surveillance sampling for from a community perspective. We don't have the details yet. We're very early in that discussion as to how that might happen. Some of that would be acute sampling, some of that would be serosurveillance. But yes, we are working to do that. And again, that will, in the final analysis, help us to better estimate the true number of cases that occurred in our community.
And would that be for everyone in the population, just those who had recovered, the family members of those who had recovered, those who were in close contact with those who had recovered? Who would be tested?
With the antibody test or the acute test?
What's the difference between the acute test and the antibody test?
The acute test is what's called a real-time polymerase chain reaction, or RT-PCR test, that looks for the genetic material of the virus. And that is what we use to rapidly identify this virus and other pathogens in humans. Generally, that is used for people who are sick to identify if that infection is in their body. The antibody test, with antibodies, there are several classes of antibodies. The ones that we measure for immunity are IgM and IgG. IgM occurs after about 2 weeks of infection and is the first antibody we can measure in someone to see if they've been infected and maybe developing immunity. The IgG antibody, which gives us our long-term immunity to infections, appears about 4 to 6 weeks after someone is infected with a given infection. The antibody test that has hit the market now, at least one of them can measure for both of those.
Okay. Yes, I was asking about the antibody test, but okay, thank you. Yeah, the antibody test. Thank you for specifying. Yes, but the antibody test, would everyone kind of be tested?
That's something that right now is available through a commercial lab here in Greenville, and they will test anybody that wants to be tested, as I understand it. I don't know what their supply is, but there are no restrictions on that testing. Eventually, we may do some sampling through the health department for that to test for antibodies. I know some folks are getting tested so they can donate plasma for the response efforts and treatment efforts. So there's two uses of that. One would be to identify those who've had the infection and have antibodies that could be potentially harvested and used to treat those with active infection. And then there is the sampling to help determine the true number of cases that occurred in the community, sort of on the back end of the response here.
Okay. And I know this virus is really new, but can you get the virus twice?
That's a good question. You're right, the virus is new, and I think that's an important thing to re-mention. Many infections that we deal with, we've had decades, if not centuries, of time to study these infections. With COVID-19, we've had about 4 months of time to study and become familiar with this infection. There is a group of folks who believe if you've had this once, that you are immune and will not get it a second time. There are some anecdotal reports in the literature of secondary cases. But even if we look at things like chickenpox, which once you have chickenpox, the vast majority of folks don't get a second case of chickenpox. There's a tiny, tiny percentage of people who can get a second case of chickenpox. It's uncommon, but it does happen. So we're hoping that folks who have had the infection are not susceptible to reinfection, but we're just not sure yet.
And how long would that take to know if this is something that you could get twice?
I don't know that there's a good answer to that question. I guess we'll see when, if there is a second wave or going forward, if we see people with who we know had a case developing a second case. I think that's something that'll be answered in time. And the amount of time that's going to take, I can't give you an estimate on.
Okay, thank you.
You're welcome.
Okay, moving along in our list. Next up is WNCT. WNCT, if you have any questions for Dr. Silvernail.
Good morning. I do. So first off, yesterday, national leaders were expressing a lot of interest about this idea of having a rolling reentry starting at the beginning of May. As a health leader, they seem pretty optimistic about it. As a health leader, do you kind of share that optimism or think that a reentry period at the beginning of May would be a good idea?
I think that's reasonable to certainly start considering it. That's it's both it's an economic decision as well as a public health decision. To get to the other side of this, we probably need 3 to 5 incubation cycles. An incubation cycle is 2 weeks, so 6 to 10 weeks to get to the other side of this this wave. And we are in the second incubation cycle now under this order. So we're a good start into it. So I think we need to continue to monitor. There have been some episodes where cases have flared when restrictions were released. So we want to make sure that it's done appropriately and with proper monitoring, so that as things open up and people become more normal in their activities, that the virus doesn't spread through those activities.
And that kind of leads me to my next question. If we do open things back up too early, what are the drawbacks? What are your hesitations with doing that?
Mm-hmm. Well, the potential is that if we go back to our pre-COVID-19 lives too quickly, that will facilitate the transmission of the virus, and the work that we've done to delay and lessen the impact may be undone.
And with cases in Pitt County, we talk a lot about flattening the curve. We've been getting a lot of calls and comments from viewers talking about, okay, so where are we in this process? Where are we in the curve? If you could offer any kind of commentary about where we're at with trying to slow the spread of the virus in Eastern North Carolina.
I think there's some encouraging things out there. If you look at the state curve, the curve does appear to be plateauing at a state level. I've seen some local curves that show the same thing. One of the things that we monitor for influenza is called influenza-like activity. That's a syndrome of fever, sore throat, cough that we monitor through the flu season. We started to build a shoulder in that curve, which we normally see in the springtime. We see a little sort of an echo wave or secondary wave in the springtime. But with our social distancing strategy that's been in place, the influenza-like illness rate has gone straight down for the past 2 weeks, or nearly straight down for the past 2 weeks, and is at about 2%, which is just below baseline of 2.4%. So I think those are encouraging things because the things that would stop influenza from spreading would also stop COVID from spreading. So I think you could infer that there's been an impact on COVID spread from that.
So seeing kind of some secondary positive benefits in the health world. But with maybe, what is your message to some of the people who might be tired or frustrated with social distancing? They're tired of staying home. They want to go out and shop. What is your message to them?
Be patient. I know that's hard to do. What we're doing does seem to be working, and we need to do this to get to the other side of what we call the epidemic curve. It does look like we've cut the height of that curve down, but when you cut the height of a wave down, you spread the number of persons across time. So we have to be patient to kind of get through that, to make sure that our healthcare supply and healthcare demand remain matched through this epidemic.
We're still getting a lot of viewers reaching out to us who work in non-health or facilities that are not related to healthcare, so grocery stores, factories, that kind of thing. And they're telling us that they don't have proper PPE, they don't have access to disinfectant. So I want to ask you, is the health department doing anything, or can they really do anything to help these businesses get the supplies that they need and make sure that they abide by, state and local rules?
Yeah, from a supply standpoint, we do not have supplies of these things to give to anybody. So I'm not sure that we can really help on a supply standpoint. Some supplies can be requested through emergency management, but PPE has been prioritized for healthcare workers. And if you're working in a plant not serving the public, I'm not sure exactly what your PPE needs are. Generally, that's tied to the work that you do in the plant. There's some degree of PPE. We have reached out to several employers in the community to offer technical assistance to them with social distancing, hygiene issues, messaging for their employees. I've met with some employee groups here in Pitt County to help ease their fears and make people understand. Not only are we battling the virus, but we're battling a lot of misunderstanding of the virus. And we've tried to help that way. But material things, we don't have material things to supply those to anybody.
What are some of those things that you think people are still misunderstanding or not quite grasping as we kind of go through a good chunk of time of social distancing and battling this virus? What are people still not understanding in your experience?
Well, a lot of it is the contact tracing, and it's if I was exposed to someone that was known to be COVID-19 positive and was a close contact, yes, I should be quarantined. But the people, until I become sick, the people that were exposed to me don't necessarily need to be quarantined. And we see this going several layers out where, John was exposed to COVID-19 and I was exposed to John and Sarah was exposed to me, and we're going 2 or 3 or 4 layers out. And we really don't need to go that far out. We need to go to the first ring. And then if someone in the first ring becomes symptomatic, then we would go to the next ring of contacts that individual may have had contact with.
And this is my last question in regards to testing. It sounds like we are very much expanding our ability for people to get tests here in Eastern North Carolina. We have a lot of viewers still calling in asking us, where they can get a test. Are there resources somewhere within Pitt County's website, or is there a place that people can go to see, okay, I can get a test at this location or by my doctor here, that kind of thing?
Yeah, the lag time in the commercial labs does seem to be improving. So the big commercial labs, their turnaround time is better. Any licensed physician or advanced practice provider can order that test through a commercial lab. Biden has their rapid platform, which they've been able to expand their capacity. So that's great for folks in the ED and needing in the hospital, and some of our critical access workers can be tested potentially with their panel. The state lab has liberalized their guidance for testing, and now if you fall into one of 4 categories, you can use the state lab of public health to have testing done. So it's there. It's not quite the immediate availability, and it's still recommended only for those who have symptoms of COVID-19 infection. But it is available to those who need it. Those who are symptomatic can get a test with varying turnaround time, admittedly.
That's it. Thank you so much.
You're welcome.
Okay, moving along, we're going to go to WITN. I believe Clayton Bauman, you are on the line for them. If you have questions for Dr. Silvernail.
Hi, Doctor. Yeah, my question kind of goes to misinformation and how that's kind of just a share away on Facebook, Twitter, things of that nature. As weeks go on, I think you start to sense that frustration, and people will see videos that maybe, cast a light on the science of social distancing and things like that. How do you tell people to be wary of these types of videos that are basically casting doubt on the practices that we're doing for the greater good?
Mm-hmm. The internet is a wonderful thing. It's also a devil in disguise sometimes. I would caution anyone to evaluate the credibility of the source that they're looking at. To use reputable sources. I'd like to consider myself and Pitt County Health Department as a reputable source. The CDC, the State Health Department, or State Department of Health and Human Services. We try to post information that is established to be truthful. And granted, things have changed a lot in this, and I understand that's been frustrating. It's been frustrating for us, where at times we've had one set of guidance in the morning and another set of guidance by 3 o'clock in the afternoon. So there have been a lot of changes. There've been a couple of 180s in this response. I can understand where people are a little wary, and people in general are distrustful of government before COVID. So I get that, but I would encourage everybody to validate the credibility of the sources they're looking at before they take that to heart.
Okay, I appreciate that answer. And my last question, and I know I'm kind of asking you to look into the future here with this question, but everything that's happened over the last few weeks and is likely still to come in the world of public health in this country, do you have any view from your perspective as a health director on how the public health system will emerge from this? Is it going to evolve, or are there going to be hard lessons learned?
I think we're going to see enhancements in our ability to test and test rapidly. I think that molecular testing, the real-time PCR platforms are going to be far more common. I'd like to see those in my lab at the health department, not only for infections like COVID-19, but also for some of the STIs or sexually transmitted infections that we treat to improve time from diagnosis to treatment in any infection. I think electronic reporting is going to improve. The two big labs, Quest and LabCorp, feed directly into our state electronic disease surveillance system, but many of the smaller labs that came online don't. So I know sometimes we get questions as, well, why don't your numbers match the state? And it's because the data feeds right now through multiple directions, and some of those go to the state directly, some of them come to us directly. We have to kind of go back and forth and validate those. Sometimes we find out that the person isn't a resident of our county, and public health surveillance is based on the county of residence. So that sometimes affects, there's a little give and take with those results. I think going forward, we're going to look at how much PPE we keep on hand. We generally, the health department, we don't generally do sick care. We do well care, so we don't have a lot of PPE in stock on a day-to-day basis. One of the things we found out that other county agencies were relying on us for personal protective equipment. That had never really been discussed or planned for with the health department. So we'll look at that going forward. You may have heard the term after action report. Myself, my management team are already recording things for after action report. Those can be looked at as short, medium, and long-term issues. They can also be looked at as state, regional, and national issues, and we will funnel those into the appropriate evaluation chains when the time comes. And we're also looking at, well, should we have a primary care service? Probably not at the main health department. That's a big decision. I see the county managers twitching a little bit as I say that, and dollars, but that may be a down the road answer for some of the problems that we've uncovered here with special populations, like our homeless population, our domestic violence population, who don't have places to go in the midst of this and would need sheltering or other services. So there's some things we'll consider on the backside of this. But I think the big things in public health will be the data flow and rapid molecular PCR testing at multiple levels within the system.
Thank you so much.
You're welcome.
Okay, and finally on the list, we have WCTI, Tyler Hardin. If you are on the call, any questions for Dr. Silvernail?
Hey, good morning, Dr. Silvernail. And by the way, beautiful haircut. I have to mention that. But I wanted to go ahead and first start with kind of an update on the clinical trials for a vaccine for COVID-19, if you have any kind of information involving that.
Very little, Tyler. I believe there's a couple of companies working on a candidate vaccine. We are certainly hopeful that will get into clinical trials sometime over the summer and maybe be available by late this year or early next year. We have been looking at our vaccination plans and how we could push that out to those who want to receive the vaccine and are able to receive the vaccine on the backside of this. But some of that would still need to be determined. I would assume this would be a normal vaccine administered much like any other vaccine, a flu shot or a tetanus shot, those sorts of things. But we'll have to wait and see what that product actually looks like once it's developed. But we are hopeful on that.
Definitely. And as far as the age range with these new cases, is that still from 17 to the mid 70s? Or has that
yes,
changed?
I don't believe we've had anybody older than the mid 70s at this point, and I believe 17 is still the youngest in that range.
And do you kind of have an updated range, especially with the recovered cases now?
In terms of an age range for the recovered cases?
Or an age range for just, I guess, the current cases?
The age range for the current cases would still be the same, Tyler. It would be that 17 to mid 70s. and the recovered would fall into that same age range.
Okay, gotcha. All right, thank you.
You're welcome.
Okay, that's all the media outlets for Dr. Silvernail. Before you leave, though, if you could answer a couple of questions that we had from our Facebook audience. Now, one being just readdress how soon someone can safely come back to work for any coworkers that may be concerned from someone who left with COVID-19. Once they come back to work, how safe are the coworkers in that area?
Yeah, I guess it would depend on if they were exposed before the person went out, which is part of that discussion. But the CDC would say that you need to be at least 7 days away from your symptoms and 3 days with no fever and no medicine to lower your fever. So that's a variable number. And then if you did return to work in less than 14 days, you should be wearing a mask while you're at work until you are through that 14th day. So on the 15th day from testing or presentation, you could go to work without a mask. In their earlier guidance, now they would recommend that you wear a mask from a general perspective to decrease transmission or decrease risk of infection. So generally we're looking at somebody being on the 15th day post testing or post presentation to be fit to go to work without fear of them still having the virus in their system.
Okay. Thank you. All right.
Is that it, Mike?
Yeah.
All right. Thank you.
Moving on now to questions for Vidant. We'll again start with Elizabeth with the Daily Reflector. Go ahead and state any questions you may have while Mr. Floyd's coming up.
Thank you. Oh,
Yes, go ahead.
I'm good, thank you.
Okay.
Oh, sorry.
Moving on. WNCT, any questions for Vidant?
Yeah.
WN.
Yes. Can you guys hear me?
Yes, you're good. Go ahead with your questions.
Awesome. If you could just kind of re-explain the testing capabilities that Biden now has, how they're spread out, and then kind of what that entails in the fight against COVID-19 in Eastern North Carolina.
Well, thank you for the question. So we have been for quite some time now trying to acquire the necessary testing reagents that will allow us to have greater access to rapid testing. There have been days when we had none in the early phase of this, which meant that we were really testing at the same pace as LabCorp or Quest or other public commercial labs that you could receive in many places around the region. And that meant there were days before the test results would come back. And those days could vary depending on the total volume that was being tested at the state level. So what we experienced then is patients that would come in to the emergency department or in the hospital who need certain procedures done or who need to be admitted. And we don't know if they're COVID positive, and we are waiting for days to find that out. During those days that we're waiting, we are burning through a tremendous amount of PPE because we assume they're positive until they ruled out. That kind of thing is happening with patients when you don't have the testing capability. The reason it is significant that we're now up to having about 1,000 tests a week available is it allows us to more quickly determine if the patient is not COVID positive, therefore allowing their admission or procedures or whatever that we're doing with the patient to not entail all of these protective equipment and devices and isolation and things that are going on with COVID patients. And it helps us preserve the PPE. It helps keep our team members from having to isolate the patient and those kind of things that are just hard for patients when they're recovering. So it's important for a variety of reasons. Because of all of that, we would prioritize the test to safety first. Does a patient need this test for us to know exactly what diagnosis they have and how to render care to them? And therefore, we centralize the control of our testing and allow it to be dispersed across our system in accordance with safety first with the patient, rendering the appropriate diagnostic tools, and then allowing us to know which patients should go home, which ones should be admitted, which ones would need certain procedures done. So it begins with the most acute phase of this, emergency department, ICU, in hospital, working its way into our ambulatory clinics. And then in certain cases, when the physician says a patient needs a given procedure, we may run this rapid test to determine if that patient could go forward with that procedure because their risk is lower because they don't have COVID. It also allows us to determine if certain patients in nursing homes, for instance, where it's a very high risk environment, we may send some testing capability, and we've done this a couple of times in nursing homes where there is a tested positive patient. Once we know that, we need to know the extent of spread within that nursing home environment, as an example. And so we use these rapid tests in that way. What it means for Eastern North Carolina is we are using them for safety, for effective diagnostic tools, and then to help limit the spread in high-risk environments, which is part of the whole plan of lessening the curve here and keeping it within the control limits of the health system itself. And so we're using the test judiciously to help do that. We think in the next couple of weeks, we could even be as far as having 1,000 tests available a day for us. And so as this continues, as our capabilities continue to increase, we will be using those tests more freely in the fight against COVID. But for now, we have to make sure we use all of them to the best of our capability, limiting spread and making sure patients get the right diagnostics.
I would think that this feels like a pretty big win. I know that's one of the things that we've been talking about a lot is having a shortage of tests, not having enough tests for people. I don't know how you perceive it or how health leaders that you've been working with perceive it, but I would think this would feel like a pretty big step in the fight against COVID.
It is in a variety of ways. I mentioned those on the front end that help us manage the spread and know where to put our efforts to help limit the spread of the patient. Of course, in the diagnostics of a patient, so we render the appropriate care. But even at times, there may be a healthcare worker that we need to make sure isn't tested positive. Having a rapid test on someone who may have had close contact or we suspect a risk is really important for us to know as well, so that that worker can continue caring for patients or not if they need to be quarantined. I want to remind us all that the test itself doesn't initiate a therapy for patients. It just tells us what to do with the patient or how to limit the risk of spread. The appropriate therapy for the patient is managing the symptoms of the illness itself while they're in their effective risk stage of the disease itself or the virus itself. And so rendering a positive test just tells us what to do. If you're well enough to be at home, it's the right thing to be at home and shelter in home and quarantine. If you're sick enough that you need a hospitalization, we want you to come to the hospital, and we know how to render care. We want you to call if you're suspecting you may be positive. We'll render the test and determine that appropriate level of care if you need to be in a hospital environment. But for the general public, your symptoms should be the thing that determine the escalation of your care, whether it's to a physician's office or an emergency department or at home.
That's it. Thank you so much.
Okay, moving on to WITN. Clayton, if you have any questions.
Hi, Doctor. Yeah, there's obviously in recent weeks, there's a growing chorus of voices, if you will, to reopen businesses or get things back to some semblance of normalcy. Are you, as a hospital, are you in constant contact with the governor's office, promoting, trying to stay the course as far as social distancing rules in the state and keeping a firm hand till it looks like we're getting to a point where cases are bending downwards?
Yeah, it's a great question. Every day, all the hospitals around and health systems across North Carolina come together on a conference call every day to discuss what we're seeing in each of our markets and to determine what the curve is looking like, what cases are we seeing, what's the extent of community spread. So we're not in a vacuum looking at it in any one place. We are understanding it across its impact across all the health systems. The information and the group that comes together along with our hospital association, work with the governor's office on a regular basis so that they have surveillance, they understand what's happening, they connect that to the public health and DHS systems of detection. So I think there is a very close-knit conversation about what is needed. Until we see the backside of this curve, yes, we are still continuing to promote and request the continuation of the efforts that are working today. If you remember, when we first started talking about social distancing and the aggressive nature of doing that has such a profound impact on our business communities, we said if we're successful, we're going to wonder if we were doing the right things, because we're not going to have massive spread and lives lost in an area when the health systems are overwhelmed in their ability to care for these patients. We said if we're doing the right thing and we're successful, the curve will bend downward. We'll flatten that curve, and we're going to look back and wonder if we were too aggressive. So the fact that we are where we are is not a bad thing. It's exactly what we want to see happening. As it's important to say, from Friday to today, more patients are in the hospitals being treated with COVID. So we are seeing still more patients, but we are beginning to see the positive impact of social distancing. And so we need to stay the course for now and see this curve plateau.
Thank you for your time.
Okay, and WCTI, Tyler, if you're on.
Yes, good morning. I am curious about the modeling that you all are doing involving the curve. I know that you're doing it every day from previous news conferences. Kind of where are you looking at that peak still? Is that still kind of late this month going into May, or what are you all seeing now?
Well, there are many scenarios and modeling tools that we are using to determine the effective guess we could make about spread. You have to recognize these models are complex, and they have forecasting capabilities based on a lot of variables within them, and those variables change. Social distancing has an impact, and it has an exponential impact on one of the variables, which is how fast it doubles and spreads. And so we are watching it on a regular basis, knowing that if we saw the curve changing, it could be an indication that one of those variables are shifting. The good news is that there's some consistencies across the state and here in Eastern North Carolina in the projections. And I would say our projections look very much like what Dr. Silvernail was talking about earlier. We are seeing a flattening of the curve. We are seeing the curve expand to the right a bit as the tails are flatter in the curve, which is what we want to see. And so we still see peaking sometime end of this month into next month, continuing probably with cases into June. But I just caution us that it is a projection tool, and it is filled with the variables that could be changing day to day that might influence a change in that curve. And so really, the curve is useful to give us some guide, but it is not an exact science.
And I just wanted to get your reaction too on the stricter executive order that went in place yesterday evening involving retailers and nursing homes. I didn't know from your healthcare experience, should there be more done here to continue to flatten the curve, or are we kind of right on the money as far as social distancing practices?
There are varying levels of compliance, if you will, or engagement with the social distancing behaviors. We are encouraging still social distancing, the wearing of masks in environments where people are together in proximity. The numbers stay the same, 6 feet and limited exposure to people. And then using all the tools that we can to keep clean and hygiene around ourselves and the products and services and things that we touch, knowing that the virus lives on animate objects for an extended period of time. So it's really important that people are practicing those hygienic things on products you bring into your homes, washing your hands, and social distancing over and over and over again. I don't have a comment about whether there are people doing it well or not, other than to say the request remains the same, that we continue the practices that we're talking about.
All right, thank you, Doctor.
All right.
And no one talked about my haircut, which is not a cut that I choose. It's one that was chosen for me.
Okay, we'll open it up for any other questions to any of our municipal or community partners now. Again, as I said, I think we have Pitt County Schools, Greenville Utilities, Pitt Community College also on the line. Also with us in person here is County Management and Emergency Management as well. So we'll go right down in the line with that, starting with the Daily Reflector. Do you have any questions for any of the other partner agencies that are here today?
No, thank you.
Okay. WNCT, any questions for any of the other partner agencies?
I don't think so. Thank you.
Okay. WITN?
We are set here. we're good.
Okay. All right. And WCTI. I will take your silence.
I'm good, Mike. Thank you.
All right, thank you. Okay, one quick note to our media partners, if you could please stay on this Zoom call. There were some requests for interviews on the press release that was put out today regarding changes to the WIC program. So if you can remain on the Zoom call after we go off the air, we will set that interview up for you and allow that to happen. There was also a request for some storm prep interviews as well for that. We'll have those interviews available. Just hang on this call. To all those else watching, I would encourage you again to go to the coronavirus information page of the Pitt County website. That is www.pittcountync.gov/coronavirus for all of the response information from Pitt County government and its municipal and community partners. Thank you very much and have a good day.